Hello and welcome to this presentation, an introductory look at Medicare for All. On the screen is a little bit about me and how I got involved with Medicare for All, as well as the last 10 to 12 years of history that I've had working with private insurance, insurance for business, as well as in the healthcare field and product manufacturing. So before we begin, this is going to be a self-paced presentation, so you can refer back to it as much as needed. But I do want to point out that I am not now currently licensed in independent insurance consulting. That means that I can't give credible advice for your specific situation on insurance, but I do highly recommend that anyone who has questions about their personal situation and how to protect themselves from financial bankruptcy due to insurance and health issues, please contact an independent licensed insurance provider, and I will have some resources for you at the end of this presentation so that you can do that. I do believe personally that it is very important that everyone get the financial guidance that they need to help protect themselves and is specific to their personal unique situation. Okay, with that said, let's go ahead and get started. So this presentation is going to cover basic information about Medicare for All, as well as some other proposals in place. But we're going to put a heavy emphasis on how insurance actually works. Most people, and it doesn't matter your financial background, your educational criteria, whether you're a CEO, a doctor, or in any walk of life, most people don't understand how their insurance works. And that is critically important in making an informed decision about how we move forward with access to care. And in this presentation, I will include all of my sources for citation so that you can go back and look at it yourself and make an informed decision. And all of this is presented in a nonpartisan way. So it's not red team, blue team. This is just us and what's important for our families and our communities. So with that in mind, let's look at what we're going to cover today. So personal stories in our reality. With that, think about how you've used your insurance and how you've gotten access to your doctor, to hospitals, to tests and things like that. What have been your experiences? We've all heard stories about from our family, our neighbors, or someone in our community who was turned down for service before the Affordable Care Act came into place. Well, that is actually still happening when you go for a test or something else and your insurance company denies coverage. It leaves you with making a decision of not getting the care that you have been told by your doctor you need, or you're going to pay for it out of pocket. And that is the reality that we face today. We need to understand that insurance and access to healthcare are not the same thing. And we'll go through that in detail. We're also going to cover how health insurance works under the Affordable Care Act, also known as ACA or Obamacare, how that works today and how it will work going forward. For Medicare for All, this particular presentation, we're going to answer some of those basic questions about how we pay for it and how it will affect your household budget today, specific to you and your family. Then we're going to talk about Medicare, how the program exists today and what sort of improvements are being proposed. Then before we close, we're going to have additional resources. And then because this is a self-paced presentation and not one of the live virtual presentations that I've done, we won't have obviously an opportunity for Q&A, but I will leave my information so that you can contact me directly. I also have a separate document that has Q&A in it, and you can read through that as well. So let's go ahead and get started. So as I said in the beginning, this is not a red team, blue team type of event. This is us. We all have families. We all have health concerns. Some of us are dealing with chronic issues. Others are looking forward to the future so that we can manage our health and live the best life possible. But the reality is we have leaders on both sides of the aisle telling us either it's aspirational and it's not going to work, or it's too expensive, and in fact they want to repeal the existing ACA law. So one thing that I want you to understand, and this is critically important, is both of the leaders on either side of the aisle are telling us that a program like Medicare for All or quantifiable improvements to our healthcare system, they're telling us it's not good enough for us while we are actually paying the majority of the bill for them. So in this particular slide, we've got two of our leaders. You're paying for 75% of their platinum level coverage today. And that's true for everyone in Congress, everyone in your state house, every elected official in your state, whether they're full-time and in some cases part-time, every federal employee, every state employee in your state and across the country. You are currently paying 75% of their cost for health insurance, while they're telling us that anything like Medicare for All would be purely aspirational. So why is this? Why are people in Congress telling us one thing that we know may not necessarily be true? So follow the money. And in this slide, it might be a little hard to read, but I wanted to point out two important factors. Number one, in this chart on the left here with the green lines on it, this is how much money was distributed by lobbyists to PACs and candidates directly. And you can see here where I've got those red arrows. In the year 2012 and 2016, we had record-breaking spending by these lobbyists from the insurance industry. So can you recall what was happening in 2012? Well, that was the year that the Affordable Care Act went before the Supreme Court to test if it was going to pass constitutionality. And the Supreme Court was, for a couple months, weighing their options and reviewing the legality of it. So while that was happening, you had the insurance company industries pouring money into lobbyist activity to get Congress people to speak against the law. And in many cases, they were pretty successful. But then here in 2016, we see again record-breaking spending by insurance lobbyists. Well, why was that? Well, that was the first year that we had a presidential candidate speaking on a national platform talking about a program like Medicare for All. Obviously, Medicare for All is not new. This was actually proposed when Medicare itself became law. The original plan was Medicare was going to be rolled out to every age bracket in an incremental way. Well, we've still been waiting over 3 decades for that to happen. Hasn't happened. So in 2016, it was the first time we had a national conversation about that. And you can see what the insurance industry's response to it was. Now, on the other side of this chart, we can see some of the big companies and how much they spent for lobbying activity. And you can see in that chart, there's a red side and a blue side. And that denotes which side of the aisle they were spending money on. So largely, it was pretty equal the way that they were spending money. So again, it's not a red team, blue team thing. This is about money versus those who don't have it. So my question to you is, as we look over these slides, where's your lobbyist? Where's your money? It's not on this chart. You and I as individuals and in our household budgets, we just don't have that kind of money to compete. And that's why when we look at healthcare, it doesn't seem like anybody's really pulling for us. So one more look at this, and this is big pharma and health associations in these slides. So you can see similar kind of spending. Now, this is not individual doctors or hospital groups, but these are really, really big associations. So again, if you look at that bottom green bar chart, you can see in 2012 and in 2016, record-breaking spending, and for those same reasons. So this just goes to show that between the insurance companies and big pharma, a whole lot of money is being spent to keep the status quo. So what does this do for us? So when I went and looked at health outcomes, these particular things really stuck out to me. So this $2.8 trillion in annual spending, that's not at a federal level, that is individual private spending. So that's you and I, our families, $2.8 trillion in annual spending just to get adequate health access. But what happened was in 2016, that was the second year that life expectancy in this country actually declined. That hasn't happened since the Great Depression. So what's happening? We're supposed to have some of the best health insurance and healthcare in the world. Why would our life expectancy decline? Well, the truth is we actually don't go see the doctor. We don't have hospital stays. We can't afford the care that we are given now through medication, increased costs of testing, and all of the other pieces that go with it. And the cost of living has just kind of gone up. So something has to give. And in this country, it's our health. Something else stuck out with the data that was coming forward on how we were using our health insurance and accessing care. And this is a new term that's come forward. It's death of despair. What this means is people are self-medicating and turning their depression and anxiety to other things like alcohol, drugs, maybe some risky behaviors, things like that, just trying to get out of their own skin to deal with the situation. And what struck me about that was the increased midlife mortality in particular is affecting white middle-aged men more than other groups. So these are the folks that perhaps maybe voted for Trump or were reaching out because they were getting so frustrated, doing everything right, pulling themselves up by their bootstraps and still not able to make ends meet. We all know that the middle class is declining. So across the board, that midlife mortality is affecting all of us. Now, the other part that really stuck out with me was the pregnancy-related mortality rate. The U.S. is now #1 for mortality rates of pregnant mothers, and in particular, Black women, because they're accessing care less. They're not as likely to be able to afford time off work, to go see their doctor, to get the prenatal vitamins. So while this one's across the board, on the other side of the spectrum, it's Black women in particular. So between white males and Black women, that should be the harbinger for everyone that we have a critical issue. And honestly, in our own families, we know there's a problem, but we're still trying to get through the discussion of what we need to do. So in this case, I went out and took a look at drug prices because we know across the board, if you need to use your insurance and you're prescribed a medication, oftentimes that medication is a brand name drug and not necessarily generic. And this is actually affecting our senior population as well as our veterans and other people who need to get access to care. So what's the problem? I went out and took the 4 most common prescription drugs that are consumed across our country. And I compared those with the exact same medication in other countries. And here you can see the difference in pricing. Well, Big Pharma has been very open for decades as to why they charge the US consumer more than what they would charge the rest of the global population. And their reason has always been, well, the American consumer can afford it, and they're paying for research and development. That's not exactly true. We pay our taxes to help with university studies and government studies, not necessarily paying the price of a high prescription cost, going towards that through Big Pharma. What you're actually paying for is all of their marketing campaigns, all of their executive bonuses, and their CEO pay. So think about it. The last time you sat in a doctor's waiting room or watched TV during the day, how many pharmaceutical ads did you see in just a 20-minute period? Chances are there were quite a number of them. And I can tell you that those ad prices on a cable television or network TV, they're not cheap. So that's actually what you're paying for. But it's not just prescription prices either. This is all across the board, everything that we consume for healthcare. For example, an MRI scan. Typically, the average price is around $1,000. And I can tell you, after having an MRI just 2 years ago, that $1,000 price was my portion of it. It was the discount that I got through my insurance. The actual cost was more like $3,000. But you can see it's the exact same equipment, exact same manufacturer, same trained technicians, but in Australia it's $215. In Switzerland it's $500. So where is this price disparity coming from? In essence, they will charge what they are allowed to charge as so far as we're not complaining. Well, we're starting to push back now, so this is why we're having a conversation about insurance and healthcare. Because across the board, we're just paying way too much. So one of the common questions that I usually ask a live audience is, what is the #1 destination for medical tourism? Now, this means if somebody needs to have a procedure done and they want to have it done effectively and cheaply, they will travel to another country. So the typical response that I get is someplace in Europe or someplace in Canada, but the truth is medical tourism for 3 years running now, the #1 country is Malaysia. They have some of the best trained technicians, world-class service, and it's a lot cheaper to have a procedure done there. Now for dental, Americans are going south of the border. About 80,000 Americans travel to Mexico every year to have dental work done. And this is not necessarily cosmetic. These are necessary things like bridge work and all type of required dental services, just because in Mexico, the dentists are well-trained and the cost is just cheaper. So what does that tell you about healthcare in the US? We're not necessarily leading the pack. So let's talk about the freedom here. So are you free if something catastrophic happens beyond your control? Heart attack, stroke, cancer, any of those things can't necessarily be prevented by your lifestyle alone. So you should never have to lose your home, lose your car, lose any of those assets that you have worked so hard to build just because you had the unfortunate incident of a critical illness. That's not freedom, and that's not what our country was built on. So what do we do about it? And this is where we're going to start to get into some of the proposals that are being talked about today. Okay, so right now we're living under ACA, which stands for the Affordable Care Act, also known as Obamacare. And let's be clear about it. This particular law had a lot of great consumer protections. For example, only in the US do we use the term pre-existing conditions. The rest of the world calls it health history. But pre-existing conditions could have disqualified you from insurance. And anybody who had to fill out an application for insurance in the private market will recall there were about 5 pages, tiny type, 4 columns each of all of these pre-existing conditions, everything from seasonal allergies to major thyroid problems, cancer, heart attack, stroke, high blood pressure, being overweight. Any of these things could have disqualified you from getting essential care covered by your insurance company, or you would be denied coverage altogether. So what the ACA did was made sure that you could not be denied. It also made sure that women and men were not charged differently for the same policy. Women were being charged much more whether they used their insurance or not. And age bands were being charged more incrementally. So you could have a birthday and be charged $300 or $400 more per month just because you had a birthday. Well, that's been limited too. And one of the other limits that ACA imposed was a 10% price increase cap year over year for the insurance companies. So if an insurance company decided that they needed to raise their prices in the next year more than 10%, they were required to go to the state board of insurance and make their case as to why that was. Well, if you go out and look at the data since ACA has come into place, it's risen a lot more than 10%. So these insurance companies have been successful at raising rates. And in this chart, you can see the trend from 1995 to 2010. That dotted blue line in 2010 indicates when the ACA law went into effect. And you can see that some of those costs did dip down. So every time there's a slight dip, there's new regulation that goes in place to correct the prices and bring them down. That is the purpose of regulation, to control private industry. Well, what happened? A lot of these big companies started operating as monopolies. They've just divided up the country. There are about 6 major insurance companies, with only one being non-for-profit. The rest are for-profit. And because they manage entire regions of our country and have no competition, they can raise rates even more. In fact, where I live in Illinois, there's only one major company that has comprehensive networks. Not necessarily all the doctors that I want to go see, but they do have some doctors and hospitals in their network. So that's the one that I would have to buy if I want coverage through an insurance company. So let's take a look also at that 64-year-old male. That's the orange line at the top. And we can see the rate of increase all the way to 2010 when ACA went into effect, and then it just keeps going up, except when it gets to the very top. So what that means is if you're a 64-year-old male, and even in this case, female, you're going to pay about $1,000 a month just for insurance coverage. But what happens? That line takes a significant dip. Well, what that is at 64 and a half years old, you start looking at Medicare. And at 3 months out from your 65th birthday, you apply for Medicare. And then when that birthday comes, you get that red, white, and blue card that says Medicare, and your price goes from about $1,000 a month down to about $148 to $200 a month. That's a significant price difference. And here's the other thing about Medicare as it is today. While it does have some significant opportunities for improvement, nobody turns down the opportunity to enroll in Medicare. Why is that? Well, it's cheaper, and it covers far more than regular private insurance for those under 64 covers now. So let's talk about that a little bit. All right, for those of us under the age of 65, this is the reality we're looking at. So let's go back a little bit and talk about that death of despair that we mentioned earlier. This is what it looks like by the numbers, especially if you're getting insurance through your employer, including union members, because your employer is still paying the cost of your insurance. So here we can see over the last few decades, the cost of insurance has risen 224% for your employer. The workers portion, 270. So at your annual enrollment or when your contract comes through, usually HR or someone in the executive suite says, we need you to take a higher burden of the insurance costs. We need to right size the amount that you're paying for insurance. What you also may have noticed is in order to keep costs down, the quality of your insurance has gone down too. So for example, your employer may have offered gold, silver, maybe even a platinum plan, but what you see now is mostly silver plans offered with higher deductibles. The reason for that is the cost of insurance has gone up. In order to make it affordable and not take all of your paycheck, they've gone to a lesser grade of insurance coverage. So that affects all of us. But then in that third column there, we can see wages. Wages still aren't rising to meet the rising cost of everything, including inflation. So while a natural rise in prices happens anyway, our salaries aren't rising to meet it. So when you have families who are working hard, working 1, 2, 3 jobs just to make ends meet, and every year costs keep rising, including the exorbitant amount of health insurance, it should be no wonder why people are frustrated, why they're depressed, why they can't even afford to use the insurance that they're paying so much for. Now it makes sense why we are where we are today. So this is where I want to go into Medicare for All. And I am a wholehearted, full-throated advocate for Medicare for All for some of the reasons I'm going to talk about here. To me, it makes sense. To me, it provides freedom for every American to express themselves in an economic way as well as professionally without that heavy burden of having to stay with insurance provided by their employer. And it frees up our businesses, our small businesses, our large businesses to compete in the global marketplace. And I'll explain why. So here's our insurance today. So we had talked about the rising costs. And here's where it's important for you to understand how insurance actually works. So what I did was in the area that I live in, I went out and looked at the median income. So we have some lower income workers and then some really high income CEOs, bank executives where I live. So the median income in my area falls at $72,000 per household. Now that is much higher than the national average of 42%, which has actually fallen from 46,000 several years ago. So let's take a look at this family, and I gave them the $72,000 household income. I made this family a family of 4, 2 adults, 2 children. Put the adults right in that median level income, midlife, 45. So in your 40s and early 50s, that is where you're earning your top dollar, most productive wages over your entire career. So it seemed like a good fit. So when I went out and pulled a silver level plan, which is what most of us have and can afford, I gave them a pretty good plan, one that I would have given my own clients, because not only was it comprehensive in coverage, but it had a lower deductible and still was considered affordable. So their monthly premium is $1,900, and you can see that in that first line here. So then their annual premium costs, this is the part that most of us don't really pay attention to. It's that $23,000. So remember, we had a family here who's only earning $72,000 before taxes. At the end of the year, they're going to spend $23,000 on insurance. That's a lot. So to make matters even worse, your insurance policy, all it does for you is it's like a Costco membership. It's your ticket to ride that premium that you pay every month. So it gives you a discounted rate on goods and services within the health industry. This is why I say don't confuse insurance with access to healthcare. The two are not the same. So let's say I'm an insurance company and I go to a doctor's office, and that doctor normally charges $400 for an office visit. Well, I negotiate with him and said, instead of $400, how about you charge $200 and I'm going to bring you all of my insurance customers? And the doctor says, sure. And we make that agreement. Now he's part of my insurance network. So when you have your premium paid and you go to see your doctor, what you're actually getting is that negotiated discount. Your insurance does not start to actually work for you until you've met your deductible. So in this case, this family has an individual deductible of $2,250 for one family member. Typically, you have to meet that deductible with 1 or more family members in order to max out the family deductible. So check your own insurance policy and see what it says. There's typically an individual and a family one. So what that means is, let's say one of these children is playing a sport and breaks an ankle. The typical cost of a broken ankle without complications is about $7,000. So this family for that month is going to pay their monthly premium as well as $2,250 on their deductible. And then anything over that for this one child, the insurance company is going to pick up about 70% of those charges. The rest of it are those extra bills that the family's going to pay. So this is where that next line, the max out of pocket, or MOOP as it's referred to, comes in. So in a really bad year, this family is going to pay the annual fee for having insurance and the deductible, and then any additional costs that come from medical services up to $14,000. So in a bad year, let's say one of the kids breaks an ankle and one of the parents has something serious like cancer. In that year, they're going to pay $37,000 above and beyond what they might have budgeted. So remember, this is a family household that's only earning $72,000 a year, and the majority of their expenses are going towards catastrophic health care. This is why people are filing for medical bankruptcy, why they're losing their homes, why they're losing everything, and it's not their fault. So this last line is also important. If you are on the healthcare marketplace and you are eligible for a subsidy, let's talk about what that subsidy actually is. It's not a government handout. It's not a grant. It's not someone else's tax dollars. That's your tax dollars. So in this example, that family earning $72,000 with a family of 4 was eligible for a subsidy premium tax credit of $695 a month. So where's that money come from? Well, what you're doing when you fill out that subsidy application is you have to tell the government, I believe that next year I'm going to earn this much money. And because I'm earning that much money, this is what my tax rate is going to be. And the government says, okay, if you're going to pay that much taxes, we're going to give you an advance on your tax return next year for the sole purpose of paying for insurance. So let's think about that for a moment. If you did your taxes this year and you were getting a subsidy, you had to check a box and put in how much of that subsidy you've gotten. And that was deducted from your total tax return. So it's your money given to you as an advance. Does that make any sense? So if you give me $20 and I give it back to you and then dictate to you that you can only spend this $20 in the way that I tell you, would you be okay with that? So it's understandable that we wanted to make insurance more affordable, but what we actually did with that subsidy is we took your money and told you how you were going to spend it. We didn't bring down the price. We didn't cap insurance companies and tell them that they needed to refine how they do the costs. We didn't do anything but mandate how you spend your own money. And that's the reason why the healthcare law was put before the Supreme Court. So if there are additional questions on that, because I know it was a pretty complex explanation of how insurance works, again, I'll put my contact information and I'll help you go through some of these things. But this was so important for everyone to understand how insurance actually works today to protect your family and your financial situation going forward. And again, I do strongly recommend that people consult with a licensed, credible, independent insurance consultant, because they are there to work for you in your unique situation to help you avoid medical bankruptcy and make the best choice that's available to you. Okay, we'll move on. Okay, so the cost of Medicare for all. Right now, we're going to focus on the House bill that it has been proposed. This has been something that's been out for years. It's a slightly stronger version right now before Congress in the House. Senator Sanders has introduced one for the Senate that is similar, but it has not been rated by the CBO yet. So I'm going to stick to the one in the House bill. So that one right now is expected to raise your taxes 6.5%, about 6.5%, could be as high as 9%. So what we hear in the headlines is Medicare for all is going to raise your taxes. That's true. It absolutely will. But when we look at our household budget, we look at not just what our expenses are, but what our savings are too. So this particular slide takes you through your personal calculation on what you're spending now compared to a 6.5%. So we've got to get it to an apples to apples comparison. So we're looking for the equivalent tax rate that you're spending today on accessing healthcare. So I went through mine, and what I ended up with at the end of this calculation was we were spending about 31% of our tax equivalent on healthcare in my household. That's 3 adults. My son is 23. That's a lot of money. But it's also a lot more than a 6.5% tax. I would save exponentially in my household by paying more in FICA taxes to get Medicare for all. So on this chart, it shows you how to calculate your own costs. So what you can start with is take the cost of your insurance, whether you pay it yourself or you pay it through your paycheck. Take that cost and multiply it by 12. So if you get your paycheck twice a month, then take your total monthly cost, multiply it by 12. And then remember that deductible amount. So whether it's family or a household, either way you want to do it. I did the family just because that is a real cost and a real risk. So I add in the deductible amount to the annual cost of my premium. And then you take that number and divide it by your income. How much money do you make a year before taxes? Do that for your household. So that is the cost of your insurance plus your deductible divided into your income. And then to get the percentage, you just multiply that number by 100. So again, in my case, it was 31%. So don't forget that we're also paying for not just health access, but vision and dental and prescriptions. And then are you also paying a policy for long-term care insurance? Anything related to the cost for care of the body is what you want to look at. So like I said, my household alone is going to save exponentially, but it's not just my household. The employer does too, because remember that chart where we looked at the cost of insurance for your employer. While the cost is high for you, employers are spending a ton of money on that benefit that goes to overhead. So while my cost is 31%, the employer's cost is probably around 38% or more just to cover insurance. Now they would be charged under Medicare for all 9%. So they're also going to get a significant savings. So as a small business owner, mid-sized, large company, that's a huge savings for them. What can they do with that money? And for people who are in a union, the bulk of the union contract negotiation goes towards your benefits. And sometimes these can drag out and a strike can ensue and you're out of work on a picket line for 2 weeks. What would happen if the cost of insurance was knowable, the employer could plan for it, and you didn't have to worry about it as part of your contract negotiations? Would that make annual negotiations a little bit easier and help your employer save money in the long run as well? These are all the things that we need to consider for our own household budgets when we weigh the cost of what Medicare for All and some of these other proposals will actually mean for us. So for Medicare for All, I looked at the new House bill. This is HR 1384. The other one was 676. So in this particular bill, look at a little bit more about what those costs actually mean, especially for our seniors who are on Medicare right now, those who are on a fixed income through disability, retirement, or anything else. If your earnings are under $25,000 per year, then the cost to you for Medicare for All is $0. So all we're looking at are those families and households above 200% of the federal poverty limit. If you're earning a paycheck every year and you make over $25,000, that's where that tax amount is going to come in. So we can see the bottom 95% of the entire country, every working family in this country is actually going to save money. And that means that there's no deductibles, no co-insurance, no copay, no having to make those hard decisions about do you eat this month or do you pay for prescriptions? And that is for 95% of the country. But I do want to call your attention to the bottom 5%, those two bands down below that are in red. Well, why are they in red? Let's be realistic. They are actually going to pay a little bit more under Medicare for All because for the last few decades, they have not been paying their fair share. The people who have been paying that subsidy to those top earners is us. So all we are doing is right-sizing the bill for everybody for equity, cost fairness. That is all that we're doing. Okay. So here's a little bit more about how we pay for Medicare for All, because that cost comes up a lot. So let's again go back to our household budget. When you stop spending money on frivolous things, you save money. And when you get a better job with a higher pay rate, you have earnings come in. So both of those events together increase the wealth of your household. And it's the same principle when it comes to Medicare for All. So when we look at the red side of this chart, these are all the cost-saving things that is planned as part of Medicare for All. Right now, we have all of these disparate systems of healthcare, from private to VA to Medicare to Medicaid to people who don't have insurance at all, and we all pay for that in the long run. We're going to stop doing these things. We're going to negotiate lower drug prices, which means it's going to save us all money on the cost of Medicaid and Medicare. We're going to stop with the wasteful amount of overhead and paperwork and processing that's going on between each one of these insurance industries, the federal government, and us, the taxpayer. By stopping all of that activity, we're looking at $198 billion a year. That's a lot of fraud, waste, and abuse. So that's what we're saving. And then on the other side of the chart, that orange yellowish side, this is where the revenue comes in. So as a state and as a federal government, us as taxpayers, we're going to save from Medicaid, Medicare, the children's program, public employees, public health, all of those things by going to a streamlined system. And then below that, you can see the tax chart that we just went through, the payroll tax that you and I will pay for in our FICA tax, the smaller tax that businesses will pay. But then that last line item, the financial transaction tax, let's pay attention to that for just a second. What that means is if you have a 401k or you have a Roth or an IRA, right now, every time you invest, make a change, anything that you do with those accounts, you're paying a tax on it. But those companies that manage it for you are not. So what we're saying is, okay, Wall Street, we want you to pay a 0.1%. So that's 0.01 to 0.5% tax. Very, very small amount. And just by doing that, we end up with $442 million a year. It's tiny compared to all of the revenue that they're generating from managing those accounts for us. So all of that leads into $154 billion in new revenue. So from what we're saving, 198, and the new revenue that we're getting, 154, that's how we pay for a national health care plan. So that means the cost goes down for you and your family, cost goes down for your employer, cost goes down for all of our small businesses, and this means consumers in your local area have more money to spend to raise GDP, to help those small businesses, so we can actually compete locally and globally. Makes sense. Okay, so let's take a break here from Medicare for All and look at some of these other options that we have available. These are some of the things that are being discussed today. Repeal and replace was offered by Republican leadership in 2017, and it was scored by the CBO. At the same time, we are existing now in our situation with ACA and Obamacare. So this particular chart looks at one of those two options. If we do nothing and continue with ACA Obamacare now, or if we go with the Republican leadership plan of repeal and replace. Here's what it looks like. In that blue line below, you can see that the rate of uninsured in 2017 was 26 million. And then by the year 2026, that actually is going to go up. So keep in mind, we still have the high cost of care. We have the high cost of people not able to use their insurance. We have the burden on our businesses who have to compete in a global marketplace, and no price check on big pharma and other necessities that we need for our healthcare. So what that means for you in both of these scenarios is somebody always pays. So while it might not be the federal government, chances are it's in your local community. So if you have an employee or a colleague who cannot afford to get treatment, they are not being productive at work, they are not earning a wage, they cannot spend extra money in your local economy, and if they can't pay that bill, guess who pays it? You do. And that happens in the bad debt write-off from the hospital or doctor that goes back to your state. So while we're only looking at federal costs, keep in mind somebody always pays. And guaranteed 9 times out of 10, it's you and I. So let's take a look now at that red line. That's the Republican plan. And their plan is to roll back significant protections that we do have now under ACA and go for what they call more of an unregulated market. Well, what happens with that is you have almost double the amount of people without insurance. So while it looks like we're saving money on a federal level, perhaps even a state level, remember somebody's always paying that bill. And either you're paying for it through increased taxes, or unfortunately you're going to pay for it through your own health. To me, that's unsustainable. Okay, so I'm going to back up to the last slide, and we're going to talk about the Democratic establishment proposal for Medicare for America. This is a plan that was proposed by a think tank, CAP, and what they've said is if you have your employer's insurance, you can keep it. If you don't have any insurance or you're with CHIP or Medicaid, then we're going to put you over to a Medicare-like plan. They call that a public option. Well, here's the problem. You see all that cost saving on the left and all the new revenue on the right? Cut it in half. So what that means is they're proposing a plan with similar benefits, but none of the cost savings, very little of it, and none of the extra revenue. And in fact, their plan has not even been scored by the CBO, has not been submitted. I suspect that the numbers are actually far worse than I'm giving them credit for, which is why they haven't done it. So it's up to us to think critically about this. In your own household budget, if you take on a new expense and you're not cutting costs somewhere, is that something that you can afford? If you're not getting a higher pay raise and you take on a new expense, is that something that you can afford? Wouldn't make sense in our household budgets, but when you read through the Medicare for America, that's exactly what they're proposing. So again, I'm waiting for them to submit to the CBO for proper scoring and vetting before we actually go through each and every one of these numbers. But so far, what's on their website does not include any of the cost savings and very little of the new revenue streams. So it's something that I want you to be aware of and think critically. Okay, we'll move on a little bit. So what are we talking about with Medicare for All and the processing? All we are doing is streamlining the administrative piece. It is not a government takeover of healthcare. It's not socialism. We still have private doctors and hospitals who can make a profit. What we are removing is the monopoly of insurance. Monopolies are counterproductive and kill the free market. So when we talk about healthcare and separating insurance from actual access to care, insurance companies don't fit in at all. So the free market itself looks like this. Your household and your employees and your employers have one plan. This means that members of Congress on down to you and your family and your children have the exact same healthcare plan. And when you go to a doctor or a hospital, they get paid the same rate as the other doctors and can make a profit too based on the quality of care, competition for new patients, and how they structure their practices. That processing goes to a private company for the bill, as it does with Medicare today. So private companies all across the board. The only thing that the federal government actually does when it comes to Medicare is make sure that regulations are being upheld, run the charts and data, and monitor the system. They actually don't really get involved in day-to-day palliative care or how things work. The other benefit that we get is we get, as a nation, the group size. We get to negotiate drug prices, and that's something that we don't do anywhere but under the VA. And they pay the lowest prescription prices of anybody in the country. So now we're using the power of us working together to get lower prices, just like the rest of the world does. So here is the entire model you can see here about how the processing works. The only place in our country where we have socialized medicine is in the military. Socialized medicine means that the providers and the means are paid for and managed by the government. So in the military, you have military doctors, hospitals, and nurses. But what we're proposing is not at all like that. Still private, still for profit, still able to manage their own practices, and in many ways go back to being independent, just like most doctors wanted in the first place. Okay. And there was one other provision in Medicare for All that I really loved, because the whole idea around Medicare for All is we're in this together. So in the transition process, there is money allocated for doctors and hospitals to help them with this transition so that they can stay competent, competitive and afloat while making this transition to taking everyone on as a Medicare patient. That's important. That's us taking care of our own professionals in our own neighborhoods and helping them with the transition. The other thing it does is we have Americans today who work in the insurance industry. That's a fact. There's about 400,000 employees in the US. Now, we're not talking about the employees in India. We're only talking about American workers. Most of them are working at minimum wage. So what do? We don't want to leave them on the street because, again, we're in this together. So in the Medicare for All package is a job retraining program for each and every one of those employees so that we can lift them up and help them into a career. Ideally, it's a career within the new green job sustainable market, infrastructure, and all of those things where their dedication as employees can be redirected to something meaningful and a successful career for those people as well. Because we all work together to save ourselves money, and that means 400,000 new people, job training. Let's get them working on something more productive than just insurance processing. Okay. Okay, so Medicare, we're going to talk about this for a little bit. You may be old enough to remember Johnson and when the whole plan for Medicare for All was introduced, but the same type of pushback we're getting now on Medicare for All, we've been here before. It came through on Medicare as it was proposed back in 1965. They said it was socialism and it was going to kill competition in the marketplace, and they just said it was so horrible. But the truth is, once we got over the initial 1 or 2 year period of people making the adjustment, it is now the most loved program in the country. Again, go back to that other chart. As soon as people turn 64 and they're paying $1,000 a month for insurance, and now they get Medicare, and it goes down to about $200. Wow, that's a windfall. But let's not get ahead of ourselves, because Medicare, as anyone who's on the system now, does have some pitfalls that needs to be fixed. And the good news to you is that in Medicare for All, we're actually finally going to address some of those issues with Medicare. And that in particular is that prescription donut hole. You should never be left paying the bill by yourself and having to make a choice between, do I eat this month or medication? And in addition to that, we're going to add in a whole bunch of new coverage options that you don't get right now, even under a Medicare Advantage plan. So let's take a look at those. And remember, this is the benefit that everyone would have under Medicare for All from the age of 0 to the end of life. So it's not just anyone over 65. This is everybody. So with it, we're going to get full medical, that's your inpatient and outpatient services, as well as dental and vision, mental health services, prescription drugs. There's a small $200 per year deductible, which is, if you're a senior and you've ever met that donut hole, $200 is next to nothing. You're also going to get podiatry, prenatal, and then the big one, long-term care coverage. Most of us have to buy supplemental insurance just to have that. So at my age, I'm 45. If I were to start buying that now, anticipating that I need long-term coverage, that is 2.5 decades of payments every month that I need to make just to maybe afford long-term care on my own. But through Medicare for All, through the power of all of us working together, it's included in that package. So again, no copays, no deductible, no coinsurance, and it eliminates the financial barriers to care and ends the scourge of medical bankruptcy. So let's take a moment and really consider that. We have so many people who are at the end of their career who have stayed working for their employer because they're terrified of losing their health insurance. We have people in mid-careers who stay with their employer rather than venturing out on their own because of the cost of insurance. Remember that every large company that we have today in this country started as a small entrepreneurship. UPS was 2 guys in a garage with a bike. We don't have that level of entrepreneurship now because of things like oppressive insurance costs. So what would happen if that was no longer a burden, if you no longer had to fear that? Well, for businesses, we know that they save money by hiring younger workers. All those kids that are coming out of college who are having trouble finding work would suddenly find a new job market open to them because the people at the top can leave employment sooner. They can retire sooner. And that means the tax cost to businesses goes down exponentially. So what would that do for your local economy? I know a lot of families who struggle with the cost of daycare. If you had your parents and older relatives in their 50s and 60s able to help out and fill that burden, would that matter? If you're in your 50s and 60s and you could pursue the career that you always wanted or some different avenue and you didn't have to worry about insurance, what would that look like for you? And these are the opportunities that we're talking about if we can just get past this burdensome cost for everyone. So let's go back to those prices a little bit, because when you leave this presentation, you're going to go back to the real world and headlines, and I want you to understand this specifically, this chart in particular. Remember when we talked about what it's going to cost you and your household? And so when we look to the left side of that chart, this is the income increase that you are going to have for, and 95% of us all across this country, 95% of Americans, working families, retirees, all of it, you're going to see a cost increase. But on the other side, that right side of the chart where those increases come in, those people are going to pay a little bit more. And a large portion of that is not only are we right-sizing their insurance costs, but they're more likely to have income from investments and Wall Street speculation. These are also the groups of people who can spend more on ad campaigns and lobbyists to tell you that you are not worth the same level of care and coverage that they are. Remember this. Okay, so one last thing that I want to cover. I mentioned Senator Sanders' new bill that he submitted to the House does not yet have a number on it that I could find. When it does, I will update this. So there is a difference between the House bill and the Senate bill. My particular preference is on the House bill, in particular because it comes with a 2-year phased approach. What would happen if this version of the bill passed would be that those, I believe the age is 55 and up, would suddenly be immediately enrolled into Medicare, and children. So any child who is now covered under the CHIP program, the state coverage, would get enrolled into Medicare right off the bat. And then the rest of us would go in a 2-year phased approach. So what that would mean is whatever your insurance card now is with the logo, you would trade that for the red, white, and blue card that says Medicare on it, and it would have your basic information. It also gives us those transition relief payments for hospitals and providers and the job retraining. So with the Senate bill right now, and that one also has not been scored, but it's going to be similar to the same bill has been submitted every year for the last decade. So the expectation is it will follow the same CBO score. With the Senate bill, it's a 4 years phased approach. It does not include the transition payments or retraining for employees, but it does allow those under the year of 19 years and younger and over 50 to transition first before the rest of the American population does. So those are the chief differences: the negotiated discounts, the extra coverage, mental health, long-term coverage, all of those things are the same between these two bills. So as more information comes out about the Senate bill and the actual financial piece and costs, I will update these slides. Okay, and then here's the comparison Medicare for All versus ACA Obamacare. So here's the piece that I want to stress. Aside from the cap proposal of Medicare for America, we often hear people who are running for office or in office say, let's fix ACA. Well, they never tell you how. I have yet to see a proposal where they are fixing the existing program, and that as consumers and as voters we need to push back on, because we can't possibly make an informed decision for our families, for our communities, for our country without that level of detail. That is the minimum that's required. So what we're looking at here is ACA, is it as it stands today versus a Medicare for All proposal. And to me, the difference is pretty clear. We can keep spending a lot of money doing inefficient processing and getting less, or we can save money overall as a country, as a state, as a community, as our family and households, and get more for it by going for Medicare for All. Just makes sense. It saves money and it actually will save lives. So next steps for you. What can you do from here? Again, I'm going to have all of these slides and all of my sources available to you so you can look at it. I don't want you to take my word for it. I want you to look critically at the same data I looked at and make a decision for yourself. One of the groups that I absolutely love, and they actually just came out with their own healthcare plan, which is very similar to the one that's in the House bill, Medicare for All right now, is Physicians for a National Healthcare Plan. They've been working for a very long time on crunching the numbers, and this is led by actual doctors and hospitals, professional accountants. All of these people get together who have recognized for years that what we're doing now is the wrong path forward. So I would go out and look at some of their information. Look up the bill for expanded Medicare for All in the House. It is on congress.gov, and you can look it up. Just type in Medicare for All 2019. The bill itself will come up. It's not very long, and it's not very wonky. You can get the summary, or you can read the actual legal information that's in there for the bill as submitted. Read it. It's not very long. It's not hard reading. Then I have a couple of different resources that you might also consider: Health Over Profit and Connect the Dots USA. Connect the Dots. I've used some of the slides from Connect the Dots because this person is another activist, an advocate, and a fantastic graphic designer, and she did some of the slides for the original House Bill 676. So some of them are still a little outdated, but she does a wonderful job of conveying complex information in a simplified way. Then below that, films by business owners. Yes, these are business owners, and a lot of them are self-described conservatives. They also recognize that to compete as a business owner and to take care of their employee families, Medicare for All is the path forward. And they have actually put out information and held business summits together on their own for this particular purpose. So they've got fixithealthcare.com and Now is the Time movie. And you can look these up online and watch them for yourself. Then I am a board member on Northern Illinois Progressive Network. It's a bipartisan, well, more omnipartisan group of progressives, and we are working to forward Medicare for all. This means that we are a group of libertarians, Republicans, independents, Democrats, Democratic Socialists, who are all unified behind progressive policies. And this is where you can find some of my slides, some of my detail, and certainly find me and other members of my organization who will help to answer questions for you and provide direction and resources, whatever you may need. And then the last step, and this is where we are working with National Nurses United and other big groups who see Medicare for All as the logical path forward. They're currently right now organizing people and groups who are willing to talk to your local county and village and township elected leaders to get referendums on the ballot and other information to local organizations, as well as your congressional reps and senators. These are the people who will actually cast the vote in your name about some of these policies. So we need them to get on board too. And part of the problem is they're getting pressure from all sides, all that lobbyist money and their leadership above them, as well as other people are in their ear. So we need to go to their doors, to their offices, and we need to be there in person, because that is the only way that we can counter the amount of money that is being spent to keep the status quo. Well, the status quo is not benefiting you and me. So we need to take that extra step and take responsibility for speaking with them ourselves. So this is going to conclude the presentation now. I really appreciate you sitting through all of this, and I hope that at the very least this gave you something to consider, that you understand a little bit better about how insurance works, and that when you hear the conversation on the national platform, you'll be able to look at it with a critical eye and discern whether what people are saying is actually going to make sense for you and your family. Thank you again, and I really appreciate your time today.